in that first session, I am looking again to connect with each partner individually. And so I want to be sure that I'm managing the time so that I have time to hear from each of them and hear about the situation for them, but to hear about it in a way that is not blaming. And so with very hostile, angry couples, you are going to have a lot of management to do to bring that about. And actually, there's a whole 90 minutes session that Pete sells on our website called Rethinking First Sessions, which is geared for a very specific protocol that you can go through when you have a very, very hostile couple in front of you. But with many couples, you can take the time to connect with each of them and basically to empathically embellish what it is they're telling you. So when you're interested, you're kind, you're friendly, you're asking them questions, and you're acknowledging their anxiety about couples therapy. Like, couples are very anxious. And one of the reasons that they're very anxious is that they know their partners are going to tell you things that they've done that don't make them look good. It's a very rare person who hasn't done something that they're not in some way ashamed about in their primary relationship. And they know there's a high likelihood that that's going to come out, and that it's unpredictable, in fact, when it will come out. And many couples will have even made rules with each other before they come in about what's okay to say and what's not okay to say. And sometimes I'll even ask them toward the end of the session, did you guys decide before you came in here what wasn't okay to tell me? And I'm not going to ask them to reveal it, but I'm going to let them know that I know that that process is going on. And that there is a lack of control over what the partner says. And in that way, couples therapy is much more unpredictable than individual therapy and much more scary. And that I applaud them for being willing to take the risk and putting themselves in the room without knowing what in fact is going to happen. I want to be sure that I am stopping somebody who's just angry and bitter and blaming and nasty. And in the most extreme, if that's happening and I can't contain somebody like that, I will say to them, then what I'd like to do is have 15 minutes with you or 15 minutes with your partner and then come back together. But I don't want to allow the angry acting out partner to dominate the session and the other person not be able to speak. Underneath many of the questions that I'm asking and the way that I'm beginning to formulate what's going on, I am looking at, is there a way to give them hope? And I'm not talking about false hope, because I don't want to be Pollyanna and I don't want to pretend that things are easy that are not easy. But for me, there's so much hope often in the times that people do come into therapy and what is possible for them. And we created a thing called Stepping Stones, which is an explanation written in lay language for couples about the developmental stages of relationship. And many, many couples come to therapy because they have not been able to transition from a stage in which they expect similarity and they expect to be on the same page about so many things. And when they feel so much tension and stress, if they start to look at managing their differences. And so I want to normalize that stage. And I want to not only normalize it, but define it as a stage of progress. So if you're feeling those stresses of starting to move into a differentiation process as a couple, it's because that stage is stressful. It is stressful for any two people when they get to that stage, but it's also a necessary stage of a relationship that is growing and thriving. And so I may take some time to show them those flyers, or I may take time to talk about differentiation. I always keep a disco ball near me. I think you can see it in my little window picture. And I describe differentiation like this. You know, when we meet our partners, we are like, well, we're always like a disco ball, but we only show one side of the ball to our partners. And this is all the things, all these little mirrors that we feel good about. But as a relationship evolves, it is inevitable that this disco ball is going to begin to spin. And different aspects of ourselves are going to come out based on different experiences, based on having children, based on any number of things. And so a thriving relationship is one that can manage and support the evolution of different aspects of self being exposed. And so an ongoing relationship with a lot of vitality in it is one that has all those mirrors spinning around and people able to relate to that in each other. And so I do communicate to them the change is possible, that I've been through it many times with many couples. I know what that landscape looks like, and that they can come into therapy, take risks, and be supported in those risks, and have a guide, have an effective guide lead them through where they're going. I also want to start to talk to them about the concept of autonomous change. And by autonomous change, I mean the opposite of what so many couples do. So many couples start from the premise of, I'll change if you change. And they'll sit in your office or on Zoom, they'll sit with you and they'll wait to see what the other person does. And then if they do something, then okay, I'll do something. And so I say, you know, therapy is going to be a lot faster. You're going to save more money if you are willing to look at yourself, look in the mirror in a really honest way, and begin to make some changes, whether or not your partner changes at the same speed, or whether or not you see the changes in them. And when you're able to strongly hold that position with somebody, you will end up over time in the therapy having some very touching, wonderful moments with people. I had a lovely session last night with a couple who's been a hard couple to work with, because the husband in the couple has a pretty volatile temper, and he's had good rationalizations for calling people idiots or they're stupid, and he'll do the same to his wife. And I've been challenging him recently a lot on the way he manages his anger and whether he was willing to autonomously begin to do something about that. And last night there was a very, very touching moment when he said to his wife, he said, you know, I have to take the shield off my heart. And the shield around my heart is that anger, which has kept me safe since I was a little boy. And that's my job. It's not your job. And she was like, let me see your ID. And who are you anyway? I don't recognize you. But it comes from us being very strong about what change sits on each side when you're working with a couple. By the end of this session, I ideally want to establish that I think of my role really as having three elements. I'm definitely a therapist, but I'm also an educator and a coach. And by that, I mean that I am going to spend some time on psychoed. And, with many couples, I'm educating them either about the developmental stages or about how their brain works or about different things related to communication. And so there will be an educational component, and I will give them an example that's related to their own situation. But I also do want to be able to actively coach them. And I want to get their consent to do that. And so, in order to get their consent to coach and lead, I will explain, hey, I'm going to interrupt you a lot. And I'm going to interrupt you and I'm going to suggest you say something differently or you try something differently. And I wonder if that's okay with you. Can you and I have an agreement that part of why you're here is what you've been doing hasn't been working? And will you let me coach you as we move forward? And let's just say that you have done just a 2-hour introductory session. You want to have a strong end to that session. You don't want, if you can help it, you don't want to leave things hanging. And so I'll say we have about 5 minutes to wrap up for today. And what I'd like to do is share with you some of the things that I've learned about the two of you, and also how I see this as a major step that you've taken. And so I'll spend a few minutes like summarizing the session, telling them why I see this as a big step for them. And then I'm going to ask each of them, how are you feeling about coming in today? How has this session been for you? And I do want them to, if I sense at all that somebody's not happy, I want to make it easy and possible for them to tell me that they're frustrated or they don't like what happened. But I want to know how they're feeling. And then I'll usually make a recommendation for what I suggest next. And so I might be suggesting 2 individual sessions and then a follow-up of another joint session. Or with many couples, I'll say, how would it be for you if we agreed to work for 6 to 8 sessions or 8 to 10 sessions and then reevaluated? Therapy takes some time, and I don't want like each session to be a question of, are we coming back or aren't we coming back? Can we really dive in and do some substantial work and then see how you feel about what you're accomplishing? So if the couple is willing to sign up, then you can make a number of appointments. Some couples, you can sense their hesitation, or somebody was dragged in at the beginning and they don't necessarily want to be there. And so you'll say, would the two of you like to talk and get back to me and then let me know? And we don't have time for this today, but there's even times when I will say, I want time to think about it and I'll get back to you. Sometimes there's even homework that I give